When narcissists seek therapy, it is normally to handle a crisis in their life, such as a divorce, job loss, being depressed, being passed up for promotion, their partner putting up boundaries, or following a major blow to their fragile self. It is also not uncommon for people with narcissistic tendencies to experience other mental health concerns, including anxiety, anorexia nervosa, and substance misuse. These other issues, rather than their narcissistic traits, often encourage people to seek therapy. However, even when they do go to therapy because people complain about their behaviors, they seek to know what is wrong with other people that they treat the narcissist so unfairly. Thus, the narcissist wants to learn how to handle other people to get them to treat the narcissist well instead of learning what is wrong with them. So, if a narcissist does not know their problems are due to narcissism, can therapy address their narcissism and help a narcissist? Hello wonderful person and welcome to Narcissistic Abuse Healing. I'm Anton and I create videos about narcissistic abuse to help you understand what was done to you and help you heal from it. Please help this channel grow by subscribing. If you find this video informative or helpful in any way, please let me and YouTube know by liking and sharing it. Feel free to share your experience in the comment section as well as topics you would like me to cover. Can therapy help a narcissist? The short answer is yes, maybe, possibly, kinda. Every person can change. Narcissism is a personality disorder, or the way the person thinks and behaves, that are largely based on their beliefs. There are effective treatments for narcissistic personality disorder. So, if there are effective treatments for NPD and a narcissist can change, why don't most narcissists change, and why do people believe a narcissist can't change? The first problem. For any type of therapy to work, the person must be willing to do the work. Most narcissists avoid psychotherapy or quit prematurely when they feel threatened or uncomfortable. Thus, the main problem is that the person just does not want to change. Low-functioning narcissists, or those who use fear and violence to control, just flat out refuse to work on themselves or change their behaviors. They will often curse at the therapist and use any excuse they can to get out of there. If they are forced to stay, they are extremely difficult to work with and easily triggered to the point that they can attack the therapist. High-functioning narcissists, especially highly intelligent narcissists, often know exactly what they do and go to therapy to learn how to hone their craft, as well as to play games with a therapist. They see it as a sport to try to outsmart and manipulate the therapist. They often become even more manipulative and mentally abusive and often claim they now know what is wrong with their partners and use their supposed knowledge they learned in therapy sessions to diagnose their partners and use that as an excuse to abuse them even more. The mid-functioning or mid-intelligent narcissist is more often willing to go as they try to be nice to you or to stop you from leaving. However, they honestly think they are a nice person and you are just unreasonable. However, they too don't like to deal with their past and often only go to find excuses for their behaviors or reasons to blame their partners. Thus, most narcissists who do go to therapy have no intention at all to change any of their behaviors. And while the narcissist is in therapy, they almost get a free pass on abusing their partner as they can just claim they are working on it. Thus, they have little incentive to change as they can blame their partner for not being supportive and then in therapy blame the therapist for not being a good therapist. They now have two people they can blame for their behaviors. The second problem. The second problem is that trained and experienced therapists who can deal with narcissists are scarce. There are very few psychotherapy training institutes that focus on teaching the diagnosis and treatment of NPD. Most training programs are designed to turn out general practitioners, not specialists. To become a specialist in this field is expensive and can take at least 3 years of additional advanced training for a person to become competent in this area. The therapist also needs a lot of patience and self-control to work with a narcissist. It can take many years of working with narcissists to gain the experience to deal with a difficult client. Therapists do not always get paid more to work with narcissists, thus taking the extra time and effort and money needed to train to become competent and then the hard work involved in working with a narcissistic person. There's little incentive for the therapist to work with narcissists. as the narcissist often does not know the underlying issue to their problems is their narcissism, they often end up with psychotherapists who may not recognize that they are dealing with narcissistic personality disorder, or if they do, they have no idea how to treat narcissistic issues. The third problem. Even if you do get a narcissist who is willing to work on themselves and a skilled therapist, it will still take years to make meaningful progress. Most people underestimate the amount of time and work it takes to change your personality and work on narcissism. A full psychotherapy of NPD generally takes at least 5 to 10 years of dedicated work. Therapy is most productive if a client sees a therapist once a week. So to put it in perspective, it's going to take at least 260 to 520 or more sessions to address narcissism. And if there are other mental problems, they often need to be addressed first, which can additionally take 3 to 4 months per issue before any meaningful work on narcissism can be done. Addressing NPD is a long, slow, and complex process with several stages, and a client can stop at any point. High-functioning narcissists who are self-reflective and cope with most parts of their life well are likely to do better in therapy. Low-functioning narcissists who are unable to keep a job and have no friends or who are physically abusive often progress very slowly. Covert narcissists often struggle with self-esteem and depression and can take a long time to change. If a person is vindictive or derives pleasure from other people's misfortune, then it is a lot more difficult for them to change, and therapy may take a lot longer or fail. Most often when a narcissist stays in therapy, it is because they want to understand their triggers so that other people do not cause them as much pain. So it is still all about them and lessening their pain. Empathy for others and their impact on other people often can only be addressed after they learned and implemented new coping strategies for their triggers. So even if a narcissist goes to therapy and puts effort in, it may be years before they start showing empathy towards their partners. It can happen that a narcissist goes to therapy for years and learn how to cope better with their triggers, which makes them a happier person, and then decide to stop therapy as they see no value in changing their newfound happiness to make other people happy. What can treatment help with? Therapy can help willing narcissists to adapt to reality so that they have realistic expectations. It can help them to manage their anger, rage, and impulsivity. Narcissists can also be taught to use cognitive empathy to understand their partner's emotions, such as visually recognizing when their partner is sad, upset, afraid, hurt, or happy. They can then better respond to their partner's needs. However, this takes a lot of work and requires being cognitively in the moment. The narcissist will have to stop and use their imagination to put themselves in their partner's shoes, and then ask themselves, how are my actions affecting my partner? Therapy can help them process their fears when they do get triggered and help them manage their emotions more. They may feel less threatened by other people's actions and success, as well as take a bit more responsibility for their life. So yes, therapy can help a willing narcissist become a better person, but those who are willing to change are few and far between, and it does take a lot of time and hard work and the right therapist they can connect with. Therapy for the spouse or partner. It is advised that irrespective if a narcissist is attending therapy or not, the partner should enter therapy on their own, preferably with a different therapist. The therapist can help the partner de-idealize the narcissist, build self-esteem, autonomy, and resources outside of a relationship. The partner can learn more about narcissism and learn to stop enabling the narcissist or reacting to the narcissist pushing their buttons. They can learn to effectively ask the narcissist for what they want, as well as set and enforce boundaries against abuse. When denial of abuse is broken, the partner can see and evaluate the seriousness of the situation and the narcissist's limitations in meeting the partner's needs and being a loving partner. The partner can then better, with their therapist, honestly evaluate if a narcissist is willing to and actually changing or not, and then decide how to handle the relationship from there. Conclusion. Narcissists are extremely difficult clients, and skilled therapists are not that easy to come by. Most narcissists see no need to change their behavior, especially if they believe it is working for them. physically violent narcissists or those who are sadistic and malignant and get enjoyment from other people's pain have little reason to change. High-functioning and grandiose narcissists can fare better in treatment than covert or low-functioning narcissists. With dedication and hard work and with a skilled therapist, a narcissist can make meaningful change in 5 to 10 years or more, depending on the level of dedication and how impaired they were to begin with. If they don't commit to such a long therapy, then things are probably going to stay the same or get worse. Even if the narcissist commits and goes to therapy, there is no guarantee they are not only doing it to keep you from leaving. For a victim of abuse, betting the narcissist will change is a long shot that could see 10 to 15 years of their life and a lot of money wasted while they are still being abused. Although not guaranteed, a good indicator if a narcissist is willing to change is to look at their track record. If they are not even willing to change small things that upset you and make small efforts to be nice to you, how are they going to commit 5 to 10 or more years of their life to changing their personality, especially if they believe it is working for them? Thank you for watching. If you found this video informative, please like and share it so that more people can benefit from it. If not subscribed, please subscribe now by clicking the seductive red button. As reward for subscribing, you will get more informative videos about narcissistic abuse. Please leave a comment as it helps to expand the information covered in the video, which may be of benefit to others. Also check out my books on narcissism by following the links in the description. Thank you.